So in the discussion, just to talk about what we've learned. So strong intersectoral collaboration is essential for effective responses, especially to large-scale pandemics. A need for clear governance mandates and well-defined roles is very important, and this is just a perennial problem, and this is something that we can work on in terms of pandemic preparedness and allocating the right resources to the right levels of government. And investing in the public health workforce is required for future resilience of the public health system, especially at the local level. Policy implications, we got to strengthen the public health autonomy to adapt the interventions. This ties into these well-defined roles, and we know, this often has, legislative implications. So thinking about, how does this feed into how we write our public health acts, these kind of things, very important. Enhancing crisis leadership training for rapid response. We learned a lot about crisis leadership throughout the pandemic, and getting those lessons onto the next, generation of public health leaders is going to be very important. And building long-term workforce capacity in public health is essential, given that we're not going to stop running into health emergencies in the near term. Some limitations about our study is limited participation from Northern Canadian territories, a very different governance dynamics in the North, and so we were missing a little bit about how things worked in the North in terms of which jurisdictions did what, and how a lot of those remote communities, how that worked in that setting. Our focus was on local medical health officers. Perspectives from other public health workers may vary. We chose local medical health officers because that's really it's a standard way of assessing medical leadership at different levels. But there's probably other perspectives from nurses, from managers, from inspectors, all across the public health workforce. And data collection occurred during the early pandemic waves before Omicron, and so it's not the entire pandemic timeline up to today even, but it gives us a sort of sense of that acute phase of the pandemic only. Some conclusions: effective emergency response requires coordination, trust, and investment. Public health must be proactively prepared for future crises, and implementation research can help refine policy and practice. I'd like to acknowledge Canadian Institutes of Health Research and Saskatchewan Health Research Foundation. Thank the Urban Public Health Network and the university for providing ethical approval. That's the end of this presentation. I can hand it off to Chuck just to talk about this type of research and the work that's gone on thus far.
Thanks, Thilina. That was really good. So yeah, I'm going to talk a little bit more about some of the work that I did on the project. There were so many people involved in this project over several years to get it from just being able to do the project all the way through to getting this particular paper published as a byproduct of it. There's other papers in the works as well. But I mentioned earlier also that I used to be the research officer for the Urban Public Health Network. And it was around the time that we were doing this project that I handed that role off to Thilina, which was then, it was a time of great growth for the Urban Public Health Network research group. And Thilina, that role ended up being converted into an assistant director role, which Thilina had for a few years and has since been passed on again. And so Thilina did a lot of the work in terms of the analysis of the data collection and getting this work to the end of the road in terms of getting it all the way to the publication. My involvement in the project was more at the earlier stages in terms of identifying this area for research and developing a program of research within the Urban Public Health Network around it, as well as, and then Thilina and I worked quite closely together in developing the survey that was sent out and the questions and so forth, and the data collection process. But I thought I'd add a couple comments about kind of where this work came from, because I think they're also interesting to know, especially in the context of something like the Saskatchewan Public Health Association, where our mandate is to provide public health. Most of us work in the area trying to provide public health, but we're also sort of responsible for public health as a practice within Saskatchewan. the Urban Public Health Network Thilina talked about has been active for quite a while. And one of the real challenges that the network had encountered and continues to encounter is a lot of the research and knowledge that we have about public health tends to operate at provincial or federal levels, even though the actual practice of public health occurs at the local level. And so, one of this work came out of a mandate from the UPHN to the group to try to start to do more research, especially comparative research of local public health, so that there can be more learning happening. One of the big challenges that you'll start to encounter when you go down that road is that public health is so variable from province to province, and even within provinces over time. In the time that I've been doing public health research since about 2018, I've seen the Saskatchewan public health system change dramatically. It's organized in a completely different way than it was a decade ago. And over Corey's lifetime, 20, 30 years, it's changed multiple times. And so, we had to do a lot of work to try to identify apples to apples comparisons and create that foundation. And we've got some papers, one paper in particular has been published that describes this problem of how do we actually define local public health. And we're happy to share that if people are interested. And I guess I should also say that this work continues through the UPHN and its affiliated researchers. At this point, Thilina and I are now sort of affiliates of the UPHN research group, right? We're no longer directly in its employ, but we have ongoing projects in the areas of that I focus in, which have more to do with measuring health inequalities and health status at small area geographies and local areas to inform local decision making. Corey continues to run a team that we call our PHASER group, or the Public Health Systems and Services Research Group, which is doing more studies like the one that Thilina told us about today, getting in touch with local health units across the country and trying to describe them and talk to them about their experiences and document what it's like to try to do local public health in Canada, and also what's working, what are best practices. And then we also have projects that Thilina's involved in, like the CUSP project, which Thilina could probably plug.
Yeah, I mean, there's projects about, substance surveillance, lots of, no matter the health outcome that we're studying, like right now we're working also with HPV. It's always with a broad intention of trying to better understand the public health system and try to describe that and try to improve on practices at the local public at the local level, understanding sub-provincial things. And so I mentioned school-based immunization, and HPV is a big part of our mandate right now, and understanding substance use surveillance at a local level is really important. And all of these projects are summarized and on the UPHN website.